it will knock you back. It will knock you back. So the tummy tuck, with the tummy tuck, you're kind of bent over double when you first have it done. So you're not going to be going running for the first week. Forget that. So the first week's out. Second week, you'll be feeling better. So walking is good. You will be out walking from day one. It's good to walk. So getting out and about is good straight off the bat. And you'll the first week you will bent over double, and usually it's a couple of weeks, to be honest, before you start walking sort of more straight. So after the first couple of weeks, you can start getting into exercise, but that is sort of low impact exercise. The problem with running is the impact. So that means you can use the stepper, the cross trainer, you can use the bike, the exercise bike, but I wouldn't go running for about a month. I'd say it's about a month, 4 to 6 weeks. You're not going to feel like it. It's the impact, and it's going to be uncomfortable, and it's going to make it swell. So yeah, 4 to 6 weeks for running after a tummy tuck is what we're going to say on that one. And yup. So I don't know if YouTube's working or not, but anyway. Is there any complication if I have my hair dyed a day before my surgery? The day before my surgery? No. I mean, I'm not even going to ask what surgery it is. I'm not even going to ask that question, because I think I can wholeheartedly say no, regardless of what surgery it is. I think it's absolutely fine to get your hair dyed the day before surgery. Yeah, absolutely fine. Go for it. Go get dyed hair. I had a breast reduction and the right nipple was pulled inward and some part of the breast is still hard. Is it safe to correct the nipple inversion? Yeah, this can happen after a breast reduction. With the breast reduction, you're moving the nipple. The nipples move from a low place to a high place. So a lift is kind of an integral part of a breast reduction. And when you move that nipple, it can sometimes get tethered and pulled and inverted. So that is a risk with a breast reduction. And the part of the breast being still hard, that sounds like there might have been a bit of fat necrosis there. So a little bit of fat within the breast tissue has died again, which is a consequence of moving that nipple. The nipple's on a pedicle, so part of the pedicle where the nipple blood supply is coming might have been compromised of blood, and that is sometimes the case. So yes, you can have the inverted nipple everted, but the problem is that you worry about the blood supply of the nipple when you do a breast reduction, and I would worry about doing an inverted nipple correction on it too soon, because it could compromise the blood supply to the nipple. Plus, it could get better. So sometimes it does get better. It's not uncommon for you to get a bit of an inverted nipple immediately after a breast reduction, but then over time, as the scarring and all the tissues settle, that inversion corrects itself and the nipple comes out. So for the blood supply point and for the fact that it can get better point, both those points point to waiting, and you're looking at a year. I would say 6 months minimum, probably a year really, to get it as good as it's going to get. Let all the scar tissue settle, try and get a good a good blood supply into that nipple, especially because you've got that hard lump, which suggests there's a bit of compromise of the blood supply for the pedicle. So so in that case, at least a year really. You really want to leave it as long as possible, and even when you do it, it is going to risk the blood supply of the nipple. So how bad is the inversion and how much do you want to have it fixed, because there is a risk of compromising that blood supply. So yeah. Thank you. Hard question. I have a small mole on my chin, which is a lot of beard hair. It's pretty pink stroke brownish. It's small and slightly raised. If I get it shaved off, will I lose the beard hair? I don't want to lose the beard hair. Yes. So so getting it shaved off in that circumstance would be preferable. So the thing about when you have a raise, so the fact that it's raised means it would be suitable for a shave. So shave is only suitable for raised moles. So the fact that it's raised would be suitable. And there's pros and cons of doing a shave compared to an excision where you actually cut it out and stitch it up. And one of those is regarding the hairs, because if you do a shave, you don't go deeper than the level of the base, the level of the skin. So the hair follicles are often deeper than that. So the hair follicles will remain. Now that can be a good thing and a bad thing. So if it's on your beard and you don't want to have a scar with no hair on it, then that's a good thing, because a shave would be better than having it excised. Because if you have it excised, you'll have a scar with no hair on it, which might have a little like a defect, that line in your beard. If you've got a mole here and you've got hairs growing from it, then a shave might be a bad thing, because you might have it, you could get rid of the raised nature of it, but you might still have the hairs growing. So you might want an excision in that respect, because you don't want hairs growing in kind of places where you don't want hairs growing. So yeah, so one of the differences between a shave and an excision is a shave leaves the hair follicles. So if it's on a beard where you want the hair, then shave would be preferable. Having said that, if you've got a lot of beard, you've got a lot of beard hair. To be honest, if you've got a lot of beard hair, an excision would probably be okay, even so, because there won't be any hair on the scar. But if you've got a lot of beard hair, it'll probably cover it anyway. So if you had it close cropped, it might be a bit obvious. Watching from Australia. Hi, watching from Australia. Have one question. Luke's joined. Hi, Luke. Have one question for you, please. Why is it that some plastic surgeons use open surgical methods while very few use laparoscopic method through hairline for forehead lipomas? Which is safest option? Thanks for your input. Well, I am one of those ones that wouldn't use the laparoscopic methods. Well, because I don't do laparoscopic surgery, I don't do not laparoscopic. It's not laparoscopic. It's endoscopic, isn't it? Laparoscopic, sort of in the belly. But anyway, I know what you mean. The endoscope. You can use a sort of telescope to access the forehead, and the endoscope is usually used for things like forehead lifts, brow lifts and things like that. Could you use the endoscope to get a lipoma out? I don't know. I don't know if you could, to be honest with you. Is it possible to get a lipoma out through a endoscope? I think it'd be quite tough to get it out through an endoscope. I mean, the benefit is you're going to put the scar. Look at my bald head. Oh my God. Good God in heaven. I shaved it with a blade the other day, which I don't normally do. But it does look quite bald there, doesn't it? Now I see myself on camera. Hell's teeth. Is that what I look like? Okay. Come on, power on. Let's get through this. So the good thing about the endoscopic approach is that the scar will be away from the forehead, so you won't have a visible scar on your forehead. The bad thing is, I think it'd be quite hard to get it out that light, because you have to. The lipoma is usually deep to the galea, deep to the aponeurosis, deep to the aponeurosis, deep to the muscle on your head. So it's often quite deep, and it's often a little bit stuck. So you have to sort of So I think it'd be quite difficult. I'm not saying it wouldn't be possible, but I wouldn't do it because I don't do endoscopic surgery. And you are kind of making what is often a relatively simple operation. I wouldn't say it's that simple, but relatively simple, into quite a difficult operation there if you're going to start doing an endoscopic approach. So and the thing about forehead scars is they tend to heal beautifully. We've all got kind of laughter lines. I mean, someone obviously in my youth hasn't got them yet, but people do tend to get kind of laughter lines in their forehead, so you can hide the scar in one of the laughter lines, and so it usually fades really well, the scar. So taking a forehead lipoma out through an open method is, I would say, the standard way of doing it. It's a relatively simple procedure. It's done under a local anesthetic. You're completely awake, and the scar heals so well you can hardly see it. To make that into an endoscopic method, and by definition, only a small one could be removed endoscopically, because you couldn't get a big one like all the way out, if at all. I don't even know if it's possible. but I wouldn't have thought it would be worth going through that trauma. But I wouldn't do it myself anyway, because I don't do endoscopic surgery. But it's it's I think you're over complicating it there by trying to do it endoscopically. Personally, but it may stand corrected. If endoscopic forehead surgeons out there are going to start telling me it's great to do a lipoma removal through an endoscopic approach, then I will stand corrected. But that's where I am on it at this point of time, on the 25th of November 1913. Right. Last question. Oh, hi, look at this. People visiting. Hi, visitors. Greetings to you. Woody, nice to see you. Nathaniel. My old friends. Okay. So am I okay to leave my breast implants even though I've had them in around 17 years? I have CUI implants. Liz and Margaret in the house. Look at that. TikTok's kicking off. TikTok's always the one. Where is everyone on the other places? No. What? Anyway, let's not dwell on the size of the audience. Let's focus on the information being given. Am I okay to do my breast implants even though I've been in for 17 years? So yeah, basically, yeah. I mean, the thing about implants is that if you have a problem with implants, that's when you should look at getting them removed. I offer people a yearly follow-up, and so if you're one of my patients, you are welcome to come, and we can, I can examine you, and we can talk about implants and what to expect. But if as general advice, if you haven't got any problems with your implants, then you don't need to have anything done about them. You can leave them. If you need to have implants removed, it's because you've got a problem. That problem is usually hardening of the implants in terms of capsular contracture, or rupture, which is usually following some significant trauma. It would have to be kind of like an extra capsular rupture, or lumps or swellings in your breast, which are probably more likely to be your breast tissue than your implant. But nevertheless, if you get a lump or swelling, if you get hardening, so if you get any symptoms, obviously, I hope it's obvious, you need to seek help, because it could be your implant, could be your breast, but either way, you've got a problem. But if you have got no problems, you've got no lumps, no swellings, no hardening, you've had your implants in for 17 years and you're happy with them, yes, you can leave them alone. If you do know your surgeon, then if you're the fact you're asking the question means it's come up, so you could go and have a follow-up and just have a kind of check-up with them. But if you haven't got any issues, yeah, you can leave them. No need to do anything if you've not got any problems. So is that all right? Anyone got any questions? Speak now or forever hold your proverbials. If you do have a question and you want to ask me, then just ask me, basically, and I will answer it. Simple as that. I mean, it doesn't get any simpler than that. Just message me or email me, or comment on something else like that, and I will first of all, I will answer it. But secondly, if you're lucky and you're one of the select few, you might find yourself in next week's Q&A. That's right, you might find yourself there. I am not guaranteeing it, but it's always an option. So TikTok has just failed on me, as it does. So I think that's a message to say wish you good night, and I will see you back next week. Stop the stream. Oh God, what's happened? Oh God. Right, see you next week. I've just resumed the stream in order to finish the stream. I know that sounds of it, but it always drops me out. So I feel like I've got to properly finish it. I don't know how it looks on the outside. This might look bad, but that's what I'm doing. So you're going to finish it on my terms, not on TikTok's terms. They're going to make me. Well, it's not TikTok, so it's probably my iPad's terms because it just turns it off automatically. Oh, am I still on? Sorry, I'm still on. Hello, sorry. All right, still on. If you've got a question, ask me. But if you are wondering what's going on, then I'm trying to stop it.